Hello, my sweet friends. I'm just gonna dive right into this. So, as some of you know, I've recently been diagnosed with rheumatoid arthritis, and I've been getting a lot of questions about what exactly it is and how I've been diagnosed and stuff like that. So, I wanted to create a short little video. Might not be short at all. I've got a lot to say, but just to create some awareness about the disease, and hopefully it can help one of you guys learn, maybe even just one more new thing. If you can share it with your neighbor or your coworker or a loved one that either suffers with the disease or knows somebody that suffers with the disease, it might help them as well. Because I think there's still a big stigma around disease, around RA, and need to create some awareness. So we're just going to dive right in. How it began, for me, it started last summer, so summer of 2018. I started getting pain in the ball of my foot, and it would kind of alternate feet. Like sometimes it would be my left, sometimes it would be my right. It kind of felt like I was walking on a bruise. I thought possibly that it was the rheostat at work, so the foot pedal that we use to activate our handpiece. It could have been both of my feet because as I'm left-handed and everything's on the right, I try to use my left as much as I can, but sometimes it's just not possible. So I've kind of developed an ambidextrous type of work just because I don't really have a choice. So it could have been both fingers. So I thought possibly it was that. And then I remember my sister and I drove to New Brunswick. When was that? July, maybe the beginning of August. Anyways, from Ottawa to Moncton, New Brunswick is about a 12-hour drive. And that was honestly the worst drive I've ever had. Literally everything was so stiff. I remember getting to, actually we were going to the trailer in Pointe Shen, and like walking to the trailer, my whole family was looking at me like, why are you walking so crippled? Like something's wrong. I was like, well, we just drove 12 hours. Like obviously I'm going to be stiff. Wouldn't you be too? So then anyways, we drove back, and then by the end of the summer, that same pain started spreading to my fingers. So I would wake up in the morning, and I remember it started in my left index finger. I would wake up and it would be like so swollen, it looked like a sausage. Like it was huge. But at that point, I was working at an extremely busy office. We were working from 7 in the morning to 5 o'clock at night. If we were lucky, we maybe had a 20-minute lunch. It was just go, 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 go. So I thought possibly that it was just overuse, and that my body was telling me that I need to slow down. So I decided to leave that job. I found a new job that was significantly less busy, a lot less stressful, less pressure. But the pain never went away. It actually got worse. So it got like really bad, progressively worse in the fall of 2018. But like I said, at that point, I wasn't at that stressful job anymore. And it was a lot less busy than what I was used to. So I'm one of those people that really hate going to the doctors. All my doctor friends are gonna be like, crazy, but yeah, I just dislike it. So I kind of brushed it off a little bit until I started losing kind of my dexterity. I started dropping instruments. Oh, if some of you don't know, I am a dental hygienist, so working with my hands a lot. I need them to be flawless, basically. So yeah, brushed it off until I couldn't anymore. Like, I knew that if I'm starting to drop instruments around my patients and stuff, it's not only dangerous for me, but it's dangerous for them as well. So In January of 2018, I finally went to go see a doctor. I still don't have a family doctor because, I don't know, I've been on a waiting list forever, but it's basically impossible to get a family doctor in Ontario. So I just went into a walk-in clinic, and he sent me for blood work, and he said that it would take about a week to get the results. So I waited a week. He also said that if he didn't give me a call back, that everything would come back normal. So I waited a week, waited a second week, waited a third week. I still didn't get a call back, and I found it weird because I knew like there was something wrong. There's no way that those blood tests came back normal. So I gave them a call back, and turns out that the lab had forgotten to send my results to the walk-in clinic. So eventually we got the results, and I had a positive rheumatoid factor in my blood, which could mean a whole bunch of different things, but it is also something that leads the doctors to believe that that helps with the diagnosis of RA. So he asked me a few other questions. What's my family history, health like, a bunch of stuff like that. And on both sides of the family we have a lot of autoimmune diseases and stuff like that. So that led him to believe that I had RA. With the blood test that he sent me for, he couldn't give me a proper diagnosis. So he sent me to go see a rheumatologist. It took about 6 months or so to get an appointment with the rheumatologist, which is actually considered pretty quick. He sent me to that specific one because they do take in patients quickly. Most other rheumatologists, it can take up to 2 to 3 years to get into their office. So my appointment was supposed to be at the end of May, and they gave me a call the exact day of my appointment, saying that the rheumatologist had a emergency meeting and they had to cancel my appointment. So at that point I was pretty ticked off. I had already waited 6 months for an appointment, but anyways, I was able to, they put me on a cancellation list and I was able to get in a week or two later, so no big deal. So when I got to the rheumatologist, he sent me for some more blood work and confirmed that effectively, yes, I do have RA. So I didn't really have any questions for him because I was kind of in shock. You never think that it's going to happen to you until it actually does. So all that being said, what exactly is RA? When I tell people that I do have it, their first response is often, "You're too young. There's no way you have RA." One thing to note is that there is over 100 different types of arthritis. So to help you understand a little bit more the differences of what RA is compared to different types of arthritis, I've made a list of 10 different things that you need to know about RA. So number 10, it's not your grandmother's arthritis. So often when people say that I'm too young, they think of the arthritis that their grandmother or their grandfather has, which is usually most likely osteoarthritis. So osteoarthritis is caused by the wear and tear of the joints. So over time, as you're using the joints again and again, the cartilage becomes thinner and then the bones start rubbing together, which creates some pain and some inflammation. The difference with RA is that it is actually an autoimmune disease. So my immune system is way out of whack and it starts attacking the lining of my joints. So the enzymes start destroying basically the lining of my joints, which causes the synovial fluid to expand or thicken, which create some swelling and some pain. So, if left untreated, RA can cause erosion and permanent damage of the joints. And it can also affect the internal organs, so your heart, your lungs, even your eyes, stuff like that. Number 9, aggressive treatment or early aggressive treatment is best. So I am sort of lucky. It didn't take me a lot of time to get diagnosed. Some people go through years of testing and different specialists to figure out exactly what it is. For me, once I went to the specialist, I was basically diagnosed almost instantly. So you want to start the treatment within the first few months to prevent permanent joint damage. The drugs that they use to treat RA are pretty aggressive. So I am on a immunosuppressant. So the immunosuppressant, its goal is basically to try and suppress the immune system, to stop it from overworking and stop it from preventing, or help it to prevent any further joint damage. Now the thing with immunosuppressants is they do have a lot of side effects, so my immune system is lowered because of it, so I'm more prone to catching any other flus or colds or sicknesses, stuff like that. They cause a lot of fatigue, loss of appetite, but they do help with the joint damage, so it's kind of a balance between the both. I haven't been on it long enough to actually tell if it's making a difference yet. They say that it takes about 8 weeks for it to start actually working. I've been on it about 5, so it's hard to tell right now, but it seems to be taking me less time in the mornings to start and get going, so that's a good thing. Number 8, people with RA have to protect their heart. So with RA, you're at a higher risk of heart disease, so it's really important to eat healthy and do some sort of exercise if you can. The leading cause of death in people with RA is actually heart disease, so there's one thing you need to know. Which kind of leads into number 7. Exercise can be medicine, but it can also cause damage. So it's good to incorporate some sort of low impact exercise, like walking or swimming or cycling, in your routine, not too much of it and not while you're in a flare. So if you're in a flare, you want to try to avoid overusing those joints. Number 6, there are good days and there are bad days, which is really hard to understand for some of my family members. They don't understand how some days I can be completely fine, ready to hike up a mountain, and other days I'm just so sore I can barely get out of bed. So with RA is sometimes you will be doing fine, and then all of a sudden you fall into a flare where you're a lot more stiff, your joints are a lot more painful, like trying to move your joints is a lot more painful, you have a lot more fatigue. Number 5, which also leads into or 6 and 5 are kind of leading in together. We may not look sick on the outside. RA is considered to be an invisible disease. So yes, sometimes you can see the swelling in the joints, but other days they look completely fine, but they are still like so painful. The simplest tasks, brushing my teeth, putting my hair up in a ponytail, tying my shoes, getting dressed, these are all tasks that cause excruciating pain, especially in the morning because you've been, not moving for 6 or 8 hours or however long you sleep, but it can also get worse at nighttime as well with the overuse during the day. Just be aware of basically the people around you. Number 4, age is not a factor. I cannot stress that enough. When people tell me that I'm too young to have RA, they don't understand that RA can affect literally any age. So usually the onset is in women around 30 to 60 years old, but it can even affect children. Number 3, there is no cure. The goal is to reduce the symptoms and improve the mobility, but there's no cure. So I'll be living with this for the rest of my life. Number 2, RA continues to stump doctors because they don't know what the cause is. They know that it's autoimmune, but they don't know what exactly causes the immune system to start attacking its own self. Number 1 is something that I need to keep reminding myself because I haven't attained that yet. Remission is possible. So with the medication and with healthy eating and all these different little tasks that you can do to help yourself, it is possible to get into remission and reduce the joints that are involved, reduce the levels of blood proteins that indicate inflammation. So when I initially got my blood test, my CCP levels were above 300 milligrams per liter, which is crazy because in any normal person it's usually under 3. So that just shows you how much inflammation people with RA do have. With all that being said, if you are still watching, thank you so much. I hope that you learned a thing or two. If you know somebody with RA, or you know somebody that knows somebody with RA, share this video with them. It might help them out a little bit. And if you have any questions, drop them in the comments below. I'll try my best to answer them. And yeah, I hope you guys have a great day. Cheers, guys.